So I want to talk about scoliosis and pain on this show here. And scoliosis refers to the spine, looking at the spine straight on, okay? So ideally the spine looking at you straight should be straight up and down. That would be the ideal position. When we look at the spine from the side, this is not scoliosis, right? This is just bad posture. Now, of course, if somebody has buckles in their spine from front to back, that they might also have this too, but they are basically separate entities. So when I say scoliosis, we're looking at the spine straight on, and we see curvatures or buckles in the spine here. Some people can have one buckle in the spine, and often people with scoliosis have two buckles. If we take an X-ray and measure the amount of misalignment on an X-ray, this would be 0 degrees, this would be 5, this would be 10. We don't even use the word scoliosis until you reach at least 10 degrees, and then go from there. So I'm going to talk about 3 cases here. They happen to be 3 women, different ages, and different degrees of misalignment on their scoliosis. Okay? Now keep in mind the amount of degrees of misalignment doesn't necessarily correlate with the amount of pain that you might have. I know people that have wonderful looking spines and they're almost 0 degrees of misalignment, and they can have pain from injury or poor upkeep and so forth. And I know people, in a moment we'll talk about this, with significant curvatures and no pain. So it isn't necessarily a predictor of pain. However, I do say this, whether you have a scoliotic curve or like me, you have a congenital alignment issue, facet trophism in my case, of the joints in your lower back, or somebody else with a spondylolisthesis or anterolisthesis or retrolisthesis with the bones lining up like that. That doesn't mean that you have to have chronic pain forever. It just means if you have one of these things in there, you have to work a little bit harder than the next person. We should all take care of our teeth, whether you have a problem with softer enamel or you don't. We all need to take care of our teeth. It's just somebody that has a little bit of a gum issue or an enamel issue or something just has to work a little bit harder. Do you follow? So somebody with a misalignment in the spine or a congenital thing like I have or somebody else, you just have to work a little bit harder on management and upkeep. And that is the takeaway here, management and upkeep. So 10 years ago, a 40-year-old woman comes in to see me. She knew she had scoliosis. She had a 64-degree scoliosis. So 64 degrees in the middle back, 35-degree curvature in the other direction in the lower back. She already knew that. Now, she had chronic pain. She wrote a gorgeous testimonial, which is on my website. I first came to Dr. Fuller for pain in my back and neck due to scoliosis, and then she also had something newer, tingling in her hands, which really prompted a phone call. I've never been to a chiropractor before. I didn't believe that there could be ever be a time that I would not have pain on a daily basis due to the work that Dr. Fuller did in staying consistent with the exercise program that we put together. My back and neck are virtually pain-free. That's the key here, and in a moment I'm going to tell you how she was experimenting with doing the exercises and not doing the exercises and the outcome, as you can imagine. Dr. Fuller is a miracle worker. Thank you very much. And I'm so thankful that he took the initiative. I took the initiative to come in. I'd recommend him to anyone who has pains in their neck and back. Okay. So she also had disc degeneration. Some of the discs were wearing down, like wear and tear on the tires of your car that are out of alignment. And that is one thing with a significant scoliosis like she has. The front end of the car is out of alignment more so than the average car, so the tires have a predisposition to wear down a little bit faster. That's what happened in her case. We worked on her 3 times a week for 6 months. Now pain-free. That was 10 years ago. She did maintenance care with me ongoing. She found that she had to come in every 3 to 4 weeks to keep her body tuned up. Throughout that multiple year period, she found if like she went on vacation and was out of her regular regimen of doing her spine stretches in the morning, in the middle of the day, and in the evening, pains would start to return. But when she got back to her stretching and exercise program, she kept it under control. That's the key now with if you have a chronic problem or not, if you have scoliosis or not, good management. That's the key, good management. Second case, 38-year-old woman. She comes into me 2 years ago, so in 2019. 30-degree thoracic curve up in here in the middle back area, 50 degrees in the lumbar curve as well. She knew she had scoliosis. In her 20s, she had low back pain, but what she found was a lot of activity tend to take care of it. She did Pilates, running actually benefited her, and a lot of stretching, so she was on that regimen. Prior to calling me, a week prior to that, she had a sudden flare-up of low back pain and hip pain. She found that sitting and bending and lifting made things worse, just like anybody else with lower back trouble. And she had also off and on neck pain for caring for her kids. Okay? So after a month of care in my office, she was feeling fine, back to normal, back was feeling good, hip is feeling good. She's under wellness care now. So it was about a year and a half ago that she started to see me. Now she's on wellness care, coming in every 3 to 4 weeks. And what we have done now, in all 3 cases that I'm going to be talking about, not only did we set them up with specific stretching exercises, but because of their buckles and curvature, I have them do some special blocking and molding at home to just try to nudge the spine in the opposite direction of what's going on. As an example, and you shouldn't do this at home unless you are under care with a knowledgeable therapist or chiropractor or orthopedic, whatever, that if somebody has an upper curvature to the right, let's say, I might have them do some block molding, which is just going to kind of nudge them in the opposite direction. And the goal there isn't necessarily, when we're adults, to change that. The woman with the 64-degree scoliosis, we didn't straighten that out. It's never going to be straightened. This woman here with the 50-degree scoliosis, the goal is not to make that straight again. That's not going to happen. The goal is to manage it really well and maybe prevent it from getting any worse. That's why we do the exercises and the molding just to try to take some stress off of the spine. The last one is a 56-year-old woman. She's been a patient of mine for 20 years. She knew that she had scoliosis. She has one curve in the lower back at 20 degrees. And we have worked with her various things throughout the years. Recently, the reason I'm mentioning her now is recently she had another flare-up, lower back pain on the left side that was radiating into her hip and halfway down the leg. And of course, she was frustrated. It was limiting her walking. And here we are in winter in New England, limiting her, her snowshoeing. And she said, hey, what can we do about this? You know, we need to step this up. Now, she was already coming in for maintenance care once a month. So she came in. We did some different things chiropractically. We reviewed her stretching routine at home. And I found that she was doing her morning stretches, but she wasn't doing them in the evening. So I said, hey, let's step this up, and we're going to do evening stretches. Then we got into the blocking and molding again, so she stepped up that. She did a little bit of time, but then she nudged the time up, which was nudging her spine back more towards midline. Again, the idea is not going to fix it, but just taking some of the stress off the discs and joints and ligaments and nerves and so forth, right? So she's doing more of the blocking and molding that's appropriate for her. And then sure enough, she comes in a month later and says, you know what, I'm doing better. I can walk longer. I'm having less pain with walking. It's not bothering me at night anymore. I can snowshoe longer with less discomfort. We're definitely on the right track. So it just took us stepping up that home management, making sure we're following through that with that wellness care, which is great. Once again, if you have scoliosis or if you don't have scoliosis, if you have a congenital problem in your spine or you don't, the key is good management and following through. So even if your spine is out of alignment like this, it doesn't mean you have you're destined to have chronic pain. If you work at it, here's some cases, and I have many other cases that I could talk about as well that came out successfully. As a last thought, if you're a child and the scoliosis gets caught, and you can see that happening, the goal would be to straighten it out with appropriate exercise techniques, maybe bracing, definitely spinal molding, and so on and so forth. So if it's caught early, you can go after that and make that happen. I have seen lots of young kids come into me with more minor buckles and scoliosis, and we monitor that and we do some work, and as they go through growth spurts, we actually see it straighten out. So that's very encouraging as well. I'm Dr. Scott Fuller.